Hello, my name is Brittany Atkerson, and today I will be talking about HIV and AIDS in Atlanta, Georgia, a stateside epidemic. Here we see a timeline of HIV and AIDS. In 1959, there was the first known case of HIV in a human in the Congo. In the 1960s, HIV arrived in the Americas. In 1981, pneumocystis pneumonia was found in 5 otherwise healthy gay men in LA. This is what started a lot of legislation regarding HIV and AIDS. In 1990, the Ryan White Comprehensive AIDS Resources Emergency, aka CARE Act of 1990, was established. In 2010, we see that the Patient Protection and Affordable Care Act was enacted. So HIV and AIDS in Atlanta, Georgia. So let's look at the background of Atlanta. Atlanta is the most populous city in the state of Georgia by the numbers, estimated to be slightly under 500,000 as per the last U.S. Census. It's home to the CDC, aka the Center for Disease Control, Emory University, Grady Health System, and Wellstar Atlanta Medical Center. However, it boasts a 19.2% poverty rate. It's a predominantly African American city with a population estimated to be 235,513 as per the last census. So, almost half of the population in Atlanta is African American. So, a stateside epidemic. Here we see persons living with HIV in Atlanta, Georgia, and surrounding public health districts as of December 31st, 2021. So we see that here in Fulton, which is the Atlanta district for the Department of Public Health, we see that they are almost double DeKalb, which is the next highest. So looking at those rates, you can definitely see that HIV in Atlanta is a very large deal, compared to East Metro, Cobb Douglas, Clayton, LaGrange, and DeKalb. So HIV cases are said to occur 6 to 8 times greater than the national average in some zip codes of Atlanta. This mirrors some of the rates in sub-Saharan Africa, actually. In 2019, the rate of HIV diagnosis in Georgia was 27.6 per 100,000 individuals, compared to the national average of 13.2. Cases are highest in the 20 to 29-year-old age group for both men and women, as shown in the next slide. So here we can see in the bright yellow for both sections that the 20 to 29-year-old age group had the highest rate of HIV diagnosis, with 675 in males and 104 in females in the year 2020. So some different surveillance methods in Atlanta exist. Primarily, the Department of Public Health is who monitors HIV infection. So all new cases of HIV must be reported to the Department of Public Health per Georgia law since the 1980s. This law states in short that all healthcare providers should report any diagnosed cases of individuals with any illness or health condition that may be caused by an epidemic or pandemic disease. HIV is one of those diseases. They also have McCarty, which is the Metropolitan Atlanta Community Adolescent Rapid Testing Initiative. This targets youth aged 18 to 24. So thinking back to the last slide, we're looking at the age group, who's quickly becoming the most frequently diagnosed age group. And this study showed that the highest occurrence rates of HIV in the different testing locations were in nightclubs. So here we see different transmission categories for PLWHA, or person living with HIV and AIDS in Atlanta, Georgia. So here we see that MSM, or men who have sex with men, have the highest rates of transmission at 28,396. This is compared to IV drug use, heterosexual contact, and then finally perinatal. So epidemiology of HIV and AIDS in Atlanta. Black men who have sex with men are more likely to acquire HIV and AIDS. However, I do want to mention there is a large African American population in Atlanta, so are these numbers skewed or influenced by that population? And this is likely. When half of the population is African American and the other half is composed of white, Asian, Native American, Islander Pacific, then you're looking at different rates of numbers. Food insecurity and poverty is also a very big issue with HIV and AIDS in Atlanta. One study showed that 1 in 4 participants had to choose between buying medications or buying food. And having health insurance was inversely associated with risk for contracting HIV. No health insurance equaled increased risk. It's estimated that 10.6% of people in Atlanta do not have healthcare coverage as per the US Census Bureau. Atlanta has various prevention methods and measures for HIV and AIDS, most prominently being the Ponce de Leon Center at Grady Health. This was founded in 1986 and it's one of the largest programs of its kind in the nation. It's available to those under the age of 25, regardless of CD4 count, so those living with HIV or AIDS. It offers dental services and a pharmacy in addition to its regular everyday appointments. And it's staffed by internal medicine and infectious disease trained physicians. This is important because infectious disease physicians are often trained for these different, infectious diseases such as HIV and AIDS. So these physicians more closely know what is going on. So CDC contribution of $1.5 million to DeKalb County as part of President Trump's Ending the HIV Epidemic initiative with 4 key strategies: to diagnose people with HIV as early as possible after infection, to treat people with HIV with medication to keep them healthy and prevent transmission, to respond rapidly and effectively to outbreaks of new HIV infections, and to protect at-risk populations from HIV infections. There's also the Georgia statewide Men Who Have Sex with Men strategic plan, which aims to reduce new HIV infections, improve access to care, and, quote, enhance standards for gay, bisexual, and men who have sex with men in Georgia, end quote. It has 4 key goals: to ensure that 50% of MSM are tested, ensure condom access to 90% of all MSM, link 90% of HIV positive MSM to medical care within 14 days of diagnosis, and to increase the percentage of at-risk men who have sex with men who's taking PrEP, which is pre-exposure prophylaxis. So there are various barriers to controlling the epidemic in Atlanta. One of these that I found interesting was that 35 states criminalized HIV exposure, including Georgia. There are 7 HIV-related criminal offenses in Georgia Code 16560. Activists have argued that this encourages a stigma against persons living with HIV and AIDS. These individuals may be less likely to seek testing out of fear for going to jail. Some of these laws, if you break them, it's punishable by up to 10 years in jail and a felony charge on your record. Additionally, as previously mentioned, poverty plays a large role in treatment or the lack thereof for HIV and AIDS. Program effectiveness. Recent numbers may be skewed due to the COVID-19 pandemic. So looking at data, you have to keep in mind that we have been living in a pandemic since 2019. That means that there have been fewer doctor's visits, which thus lead to less testing and reporting. However, from 2014 to 2019, the rate of diagnoses in Fulton and DeKalb counties decreased, while the rate of diagnoses in Cobb and Gwinnett counties increased. All of these are within the Atlanta area. So a different prevention and control strategy that I chose was pop-up shops. So pop-up testing sites in locations such as nightclubs, churches, schools, even grocery stores. This could aid in increasing the diagnosis rate and thus connecting more people with healthcare. You can also include a comprehensive list of clinics where they can receive care, different infectious disease specialists locally, and facts about the disease, so that when these people are diagnosed, they're immediately set up with, what disease do they have, what to expect, what specialist can they go to, where can they receive care, what are different medications. That way it's not like, oh, I have this diagnosis, what's my next step? This would also help break the stigma by having it in locations that people frequent, because if they see their peers getting tested, they're more likely to get tested themselves. And here we have different references for various information in the chart. Thank you.